16-year-old male presented to the emergency department, status post gunshot wound to the chest. He was walking down the street minding his own business when he was the victim of a drive-by shooting. He was apparently picked up by a friend, loaded into a car, and brought to the hospital. He was dropped off at the emergency room entrance door, and the car and driver took off. There is no other history available. He was awake and screaming for pain medicine. His mother, the authorities, and the trauma surgeon were contacted. He's not currently on any medications and has no known diagnoses. Past medical history reveals a stab wound to the abdomen with exploratory laparotomy about 1 year ago. His family history is unknown as his mother has not arrived yet. He reports no recent use of tobacco, illicit drugs, or alcohol.
So on physical exam for the secondary survey, we noticed that his skin is cool and moist. Cranial nerves 2 through 12 are grossly intact. On his HEENT exam, we palpated his head to look for any signs of trauma or tenderness that were suggestive of a basilar skull fracture. We also checked for any lacerations. His eyes had extraocular movements were intact, and he had good pupillary reaction. His mouth, there was no signs of blood loss and no hematemesis. On inspection of the neck, there was no JVD or tracheal deviation. On his chest exam, there was some tenderness and instability around the gunshot wound. We re-listened to the heart and lung sounds and inspected the chest tube for drainage to make sure it was draining well. And we inspected the abdomen for signs of internal bleeding. We auscultated and palpated for tenderness as well. We inspected and palpated the pelvic for pelvic stability and inspected the urethra and anus for any signs of blood loss. We also asked him if he lost control of urine or bowels, and then asked someone to insert a Foley catheter. On his neuro exam, his sensory and motor was intact on both the upper and lower extremity, and then he had good reflexes symmetrically all throughout.